Hello, my name is Daniel Fernandes, and this is Connected, the podcast of Nova Economics Club. This is the third installment of our bonus series on the research projects our club members developed last semester. Today, we will talk about the paper, Evolution of COVID Impact, a case of comparison of Portugal, Sweden, Germany, and Italy, co-authored by Francisco Pereira and Margarida Caroço, who are our guests today. We highly advise you to take a read of the paper at the Nova Economics Club website. Francisco, Margarida, welcome. Jumping right to our first question, what was your main goal with this research project?
Yes, thank you. First, I want to thank the podcast group for having us here today, and thank you, Danielle. Basically, the goal of this project was to evaluate the trade-off between public health and economic well-being during the first wave of the coronavirus in the Europe area. In other words, develop a better understanding of the effects of certain measures such as the lockdown, closing schools, prohibiting circulation, both in public health and at an economic level as well. To do so, we compared four countries in Europe: Italy, Portugal, Germany, and Sweden. And together we studied the different policies and measures adopted in each country and compared the behavior of major economic indicators.
Okay, thank you very much. In your opinion, what was the most challenging part of developing this research project?
Well, first of all, thank you for the invite and the opportunity. I would say that there's three main problems. The first one being that when we are addressing such a general and new event such as the COVID pandemic, there's always the trouble of being of losing yourself in the research project, which is, as Margarida said, measuring both the economic and the health impact. Since these are such general topics, there's a problem in the depth of our analysis, which we try to keep at a reasonable level. The second problem is that there's a big interdependence between all the variables which we are studying, which sometimes the real problem of the COVID pandemic is very nonlinear. So both the economic and the health impact are constantly in interaction with itself. But when we're writing a research project, there's got to be a sort of linear cadence to it, which might not be representative of the real problem. So we had a problem also addressing that. And thirdly, that when we are measuring things such as economic policy, the economic policy is very there's a strong relationship with the country's economy, and so sometimes it's difficult to create a framework of comparison which allows us to compare, for example, the economic policy that the German government created for the recovery of its economy, but at the same time compare it with the Portuguese plan, which might be addressing a set of problems which are completely different. So I thought that those were the three main difficulties we encountered.
Okay, thank you for your answer, Francisco. So, in your opinion, what were the most important results of the research project?
Yes, so we found that the countries that acted the fastest and implemented the strictest measures, such as the lockdown, closing schools, and imposing work from home, these were the countries that showed the greatest positive impact on public health, while these were also the countries that showed the greatest fall in economy. And what's interesting is Sweden's approach for its more voluntary nature. That is, Sweden rather recommended its people to stay home. It did close schools, but it never actually imposed a full lockdown. And this is crucial, especially when comparing to the other countries. We see that Sweden's economy was not hit so hard because Sweden never went into an actual lockdown. That is, restaurants didn't have to close, and other companies weren't forced to close. It was just recommended to work from home, recommended to stay home, and also recommended people to gather more than 50 people. And these recommendations that were more relaxed in comparison to the other countries that we studied we see this reflection in the economy, and that is an interesting find in our paper.
Yeah, I could just add that more specifically, Margarida was saying, there was always this trade-off between the quality of your health response to the COVID crisis, but then the economic impact that it had. Usually lockdowns imposed huge restrictions on consumption and business closures, which led to a huge strain on the economy. But it's interesting to note that, for example, in the first wave, while Sweden didn't impose lockdowns, they didn't create a specific response for the problem of employment, because since they thought we weren't imposing business closures, we weren't restricting consumption, they didn't have to do a sort of simplified layoff in the same way that countries like Portugal and Italy implemented. And then when we studied how the loss of consumption and the loss of employment occurred in each country, we saw that Portugal had been successful in maintaining a level of employment stable because of these simplified layoffs, and Sweden had actually lost a bit more employment than some other countries, and especially in what we call the short-term contracts or more precarious work. So even though their GDP impact and their variation in consumption wasn't as severe as any other countries, there were aspects, especially in their economic response, that still were a bit dodgy in terms of the economic response. And I thought that was quite interesting too.
Thank you for your answer. So you specified the political and economic policies of Sweden and Portugal. What were the policies of Germany and Italy?
Well, Germany was in the first wave was a sort of success case. So they acted pretty quickly in terms of their health lockdown policy. They implemented school closures quite quickly, and then they did a national lockdown similar to the case of Italy and Portugal. In terms of economic measures, they also implemented robust employment protection or job protection. They tried to maintain a level of consumption stable, increased public investment, increased the robustness of the social state by increasing subsidies, credit lines to companies who were having difficulties with the COVID impact. And so they had a very robust answer economically because they also had a very robust answer in terms of health policy. So they imposed strict restrictions, and they could do so because their budgetary constraints in terms of deficit were very small. They had enjoyed a superávit for the past couple of years. And in terms of their debt to GDP ratio was also quite stable. So they had the breathing space to impose the different policies that they wished.
Yes, and I'm going to talk a bit about Italy, which we know was the first Western country to be hit hardest by the COVID virus. And it was actually quickly became the epicenter of the virus, especially during the first wave. As we all know, we watched the situation unfold in Italy. All of the countries in Europe and around the world were watching the situation. It quickly got really bad. It registered in Italy. The first registered case was January 31st, and the 100th case was then registered on February 23rd. And everything started spreading very quickly turned to chaos. So they didn't have another option but to start a lockdown immediately imposed on the 9th of March. Schools closing, and this served as an example to the rest of Europe as well as the rest of the world. And we see that Italy did impose really strict restrictions, and they really didn't have another choice. Things were getting bad very quickly. And when it comes to healthcare, similar to Portugal, they didn't have much of the resources. The hospitals weren't used to such crazy numbers of outbreaks, so it was critical that such lockdowns were imposed, and we see stricter restrictions in Italy.
Okay, thank you. For our last question, I would like to ask, how was the robustness of the economic and health sectors of each country, and how did that translate into the response of the pandemic, and what can we learn from that?
So maybe I can start. I think the main division, it's not a perfect division, but we can kind of separate Germany and Sweden on the one side, and Portugal and Italy on the other, because they have similar aspects to them. So Germany and Sweden already enjoyed robust health systems, national health systems. They had about 11.2% in GDP expenditure. Sweden also 11%. A lot of it public. In terms of bed nurses, doctors, they had above average numbers, and their economy had already a big, robust social state. Job unemployment subsidies were quite large and quite easy to access. There was already a lot of public investment being made, and so when the crisis hit, also in terms of their restrictions, budgetary restrictions, which a lot of the countries in the south were very constrained by, these countries in the north had a lot more breathing space because their GDP to debt ratio were a lot lower. And so when the crisis hit, they didn't need to overhaul their social welfare system that much, because it was already present, it was already easily accessible. Of course, it wasn't ready for the number and the impact that this crisis brought, but they did an expansion. The infrastructure was already there, and they just needed to expand and prepare for it. Sweden needed a little different response because, of course, their lockdown policy was quite different. But the point being made is that the fact that they already had quite robust spending in healthcare helped them when they needed to expand their operations during the crisis.
Yeah, so now...
so it's not about... Yeah, you can...
Não pode continuar, desculpa.
It's not... It was just not about the fact that they acted quickly. It's the fact that they already had the resources put in place from previous years, that they just had to mobilize them and expand them a little.
And what's interesting to see, in Portugal and Italy is a bit of the opposite, as their health systems, of course, were not as robust and ready for such crazy numbers, as I explained in Italy before. And looking at data pre-COVID, Italy is the country out of the four that we studied with, also similar to Portugal, with the largest population above 65 years, and this is crucial when talking about the COVID virus, especially during the first wave, which was most prominent in elderly people. And when it comes to healthcare, Italy presents the smallest healthcare expenditure, similar to Portugal, which didn't usually spend as much on healthcare. What is interesting to note is that the Portuguese government is the one that is covering the least part of these healthcare expenditures, which can be explained by the fact that although being universal and mainly financed by taxation, the Portugal national healthcare system requires still a lot of out-of-pocket money, and this shows how pre-COVID both of these countries were not as well prepared as Germany and Sweden perhaps were. And also what is interesting to note is Portugal, being a country greatly dependent on the tourism sector, and the COVID virus, of course, impeding travel and imposing these lockdowns caused a major hit in this tourism sector. So we see that this fall in the Portuguese GDP is a lot reflected by this decrease in tourism, which has been very difficult for Portugal as well as in Italy. And it is interesting to see these similarities between Portugal and Italy and the contrasting differences in Germany and Sweden.
So, Francisco, Margarida, thank you very much for joining us.
Thank you.
Thank you.
Let's wrap the episode. Thank you very much for joining us at home too. And I advise you to see our next installment of this bonus series.